Everyone that comes in here has some discomfort, some pain. They're coming off of an injury or a surgery. Some of this hurts a bit. There's good pain and bad pain. And this right now is just good muscle pain.
I want to go back to a day in 2010 when I had been in a leg brace for I think 13, 14 weeks. And I came here and we took the brace off and I was laying on a table and you gave me a belt and you said you wanted me to bend my knee. As I started to think, oh, I'll just do this so easily, and the pain was excruciating and my knee did not bend and I burst out in tears.
So the first day is always could be a little difficult, and we try to ease people into it. People shouldn't be scared of physical therapists. We're all have great hearts and we're all here to help make you better.
Well, and that was the thing, is that I think there were 4 or 5 people that were part of the team that day. And it was interesting, there was the group that was like very compassionate and we understand, and then there was the other group, you're going to have to push through this because we want you to walk again.
Yeah,
and
positive,
so
a lot of positive reinforcement.
Right.
Yeah. Did I lay down the hammer? It's time to move, Liz. Time to move, Lynn.
You did. You really did.
Yeah.
And that was good. That's what I needed. I needed to be told that I could get better and that it wasn't going to be easy. And I think people with fibromyalgia and chronic pain, we know how hard it is every day just to get up out of bed.
Right.
And
Right.
then on top of it, I had a knee that wasn't working, and I had been told by my doctor he didn't know if I would be able to really walk normally again. And that was very, very scary.
So we just take the little baby steps. We get you at 0 to 5 degrees one day. Next day, kind of do the same thing, maybe a little more soft tissue work, a little more traction, and then it's 0 to 10 degrees. And in the period of 2 or 3 weeks, all of a sudden you're to 90 degrees. And once you're 90 degrees, you're on the bike. And we put the seat up real high, and we just kind of do baby steps to kind of make you feel comfortable. But we know we have to move the knee.
I'll never forget when I got on the bike. And
it's always a big day with everybody.
It was. I was so excited, but I had to do this. That was as far as I could go. And it was, I don't know, probably 3 or 4 sessions before I actually went all the way around on the pedal.
So again, baby steps make you feel comfortable on the bike. Not just get on the bike and crank you through it. That's not good for anybody, right? So
I think sometimes people think that they can do things at the level they were before.
Right.
And so when you have to step backwards, and this happens when people are in chronic pain, it's scary because you think, well, wait a minute, I'm not used to this. I'm used to being able to walk or do things that are exciting and make me feel good because I can accomplish them, and now I can't. I ended up looking forward to coming here, and I was amazed at the level of activity that I could do with my knee, and also the level of pain that was reduced with my fibromyalgia. You can have the opportunity to get better, and we want to encourage you to make sure that you find a good doctor if you need to see a doctor before. Most people have to have a referral to a physical therapist, and then make sure that you go to a good physical therapy center where they do know what they're doing.
And I would encourage any patients to go shopping. I mean, if you're recommended to 1 or 2 places, to go into an office, maybe do a little tour and see the comfort level that you feel, because you're going to be spending, an hour to hour and a half, 2 or 3 days a week at a place. You want to make sure you feel comfortable with the people that'll be working with you, and the settings and surroundings are appropriate for you.